Tandra, Valpada has explained in 29th and 30th chapter. In Charaka, there is actually among the Shofa Chigusa, he has explained in 12th chapter. Okay. So, first of all, the definition or the nirukti, that is Grathanat Granthi. So, anything is forming a lump like structure, it is called Granthi. So any knotty or any lump nature or a protuberance. So any growth in modern we can either call it as a benign tumor or like a cyst like that, any in or any lipoma like that. So many classification in modern is there among the growth. We have like Granthi and Arbd, like any nodular swelling we can correlate. Okay. So coming to the classification, there is Vataja, Pittaja, Kafaja, Medoja, and Siraja. So five times according to Sushruta. Charaka have added one more, that is Mamsaja. Ashtanga Hridaya has told about nine. Okay, total nine as explained. Along with the all the five of Sushruta, adding with the Charaka's Mamsaja, and after that Rektaja, Astija, and Vrenaja. So there is three classification. Just you by heart and understand. Then coming to the Samprapti, what is the pathogenesis? So Vada Deha. So actually here as a growth, there is made the predominance is there, Kapha predominance is there. So actually Ashtanga Hridaya, it is given importance like Kapha Pradhanaha. So only this sloga, try to learn that also. That is, Sushruta explained, Vadadeha Mamsamastriksha Dushtaha Sandushya Sandusha Medisha Kafanuvidam Prittonadam Vigraditam to Shofam Kurvantyado Granthiriti Pratishta. So, like that, all the Vadadi doshas are getting vitiated and it is vitiating the Dadus, Mamsa, Ashrit, and Medas also. And there is predominance of Kafanuvidam, and forming any Vritta Unnada Vigradita. That are the clinical features, the shofam or the swelling, how it will be round mass unnadam elevated vigradidam, that lump formation gradidam. Okay, so that is the explanation of Sushruta. And kapha prada, same slogan only. The importance of kapha is emphasized in Ashtanga Hridaya. Kapha pradanaha kurvanti medo mamsasraka mala pritonadam yaha shayatu sa granthi gratanat smritaha. So that is about samprapti. So coming to the types, as I told, five types according to Sushruta and nine types according to Ashtanga Hridaya. First one is Vadik, Vadaja Granthi. Ayamyade Vyedyada Edi Todam Pratyasyade Krityada Edi Bedam Krishno Amridu Bastirivadadascha Binnaha Shravecha Anilajo Asramajcha. So that is, as you all know, all types of pain. Todam, how the Toda will be Ayamyade Vyedyada Edi. So, like expanding, ayamam, expanding or hitting, vyada, or like different types of pain only. It is the type of todam. Then bedam, like pricking or cutting. Prityasyade, krityada iti. So, like something is kartana, using some weapons, we are being cut. So, like that is the cutting pain is called bedam. Then the color of the mass, how it will be Krishnam. Then Amridu means hard. Then Bastiriva Adada, it will be enlarged like a bladder. And then if it is Binnam or when pricked or when burst, what happens? There will be exudate like a clear blood, Acham Astram. A clear blood will be like serosanguinous discharge and all we can correlate. Next, coming to the Pittajam. So, Pittajam, then the here, as you all know, burning sensations, different types of burning sensation. So, Vadikam we can actually correlate to some cystic swelling, like cyst. Okay. Then, Dandahyade, Paitigam is Dandahyade, Dupyade, Chushyade, Chapapachyade, Prajaladiva Chabi, Rektaha Sapito Apyadava Abi Pittat. Binnaha Strave Ushnam Ativa Chastra. If you want, you can make as a column and learn all these classic the symptoms according to Vata Pitta Kapha. So here, there it was fully pain in Vadikam. Here, Paitigam means we are having burning sensations. How then the Hyade. Dupyati, like some duma is forming like that, or burning, different type of burning, as though burned by fire to ashes. Prajwaladiva, Jwalana, that fire how it will be. And Papachide means some throbbing sensation. Then Rekta, how what the color will be. Rektaha Sapido. There it was Krishna, here Rekta Sapido. Yellowish red, or red or slightly yellowish. And if it is been either burst or either pricked, what happens? There will be exudate of warm blood. Okay, warm blood in large quantity. That is the Ativa Ushnam Astram. Straved Ushnam Ativa Chastram. So excessive bleeding will be there, and that blood will be very warm. Okay, so that is the Pittaja Grandhi. Next, coming to the Kafaja Grandhi. ಕಫಜಗ್ರಂಥಿ ಶೀತೋ ಅವಿವರ್ಣೋ ಅಲ್ಪರುಜು ಅತಿಕಂಡು ಪಾಷಾಣವತ್ ಸಂಹನನ ಉಪಪನ್ನಃ ಚಿರಾಭಿವೃದ್ಧಿಶ್ಚ ಕಫ ಪ್ರಕೋಪಾತ್ ಭಿನ್ನಃ ಸ್ರವೇತ್ ಶುಕ್ಲಂ ಘನಂ ಚ ಪೂಯಂ. So first of all, as you all know, kapha means shita. Shita guna is there. There won't be any discoloration. So avivarnam. So Krishna, rekta sapita. Here it is avivarnam. Then alparujam, as you know, the all alparujam, adikandu, that is a typical symptom of kapha. Then pashanavat, that hardness will be like a stone. Pashanavat samhanana upapannaha. So it will be like a big grown like big like a stone. Chirabhivriddhi, it is a gradual or slow growth will be there. Kapha prakopat binnaha, when it is pricked or exudates, what happens? The exudate will be shuklam khanam chapuyam. The pus will be whitish, curd like color, and in modern also they will tell. So thick pus which is whitish in color. Okay, so that is the kafaja grandhi. Next, coming to the medoja grandhi. Sharira vriddhi kshaya vriddhi hani snigdho mahan alparujo adikandu ಮೇಧಕೃದೋ ಗಚ್ಚತಿ ಚಾತ್ರಂ ಭಿನ್ನೆ ಪಿನ್ಯಾಗ ಸರ್ಪಿ ಪ್ರತಿಮಂತು ಮೇಧಃ. So this is important, that point. Sharira vriddhi, as you know, if someone is having fat, that nature is like that, and they are increasing in weight, means any growth will be showing that increase also. So that you can correlate. Sharira vriddhi kshaya vriddhi hani. According to the body nature, there will be shaya and vriddhi, and there will be snigdha, extra, more than kapha. If medas is there, snigdha will be there. Mahan, that big in nature. Then alparujo adikandu, that is similar to kapha only. Adikandu and alparuja. And if it is bin or burst, what happens? Pinyaga sarpi pradimamtu meta. Something gelatinous, we can correlate like secretions like gelatinous substances are oozing out. So that is the medoja. Next, coming to the Siraj Granthi, that is one of the important topic in this. Mostly, as a whole, Granthi is sometimes asked, but rarely. But for 5 mark, mostly asked question is Siraj Granthi or varicose vein. Modern correlation is varicose vein. So varicose vein we can learn when we are learning the veins, disease of veins. Okay. So here Ayurvedic portion is Siraj Granthi. So it comes under Granthi, and the type is like how it is. First, again, he has explained Nidana and all. Vyayama Jadir Apalasya Tailstairakshipya Vayurhi Sira Pradhanam Sampidi Sankochi Vishosha Chabi Grandim Karoti Unnada Mashu Vrittam Grandihi Sirajaha Satu Kritra Sadhyo Bhavet Yadisya Sarujash Chalasha Aruksa Eva Apyachalo Mahamsha Marmothidamshabi Vivarjaniya. So what is it? It is the mainly the in persons who is weak, the abala people, or because of the rukshada in their body, and they are doing excess of work. So as you know, varicose vein, how either they are occupational, or because of the long standing, also that because of the excess of activity in that limbs. So here what happens, that because of the excess of activity, vada is getting increased or aggravated excessively. That is their akshipya vayurhi sira pradhanam. That vitiated vayu is entering the sira, the veins or the network of the veins, that is sira pradhanam. Then what happens? There will be sampidi sankochi vishosha chabi. So in the veins, that it will cause squeezing of the veins happens, and it causes the constriction and dries up, that shushka nature, drying of the because of that loses the elasticity of the veins and give rise to an elevated quick developing round swelling, that is that which is having the unnada ashuvritam. So granthi which is having unnadam, that is elevation is there, and ashuvritam, round bulging of the veins you can see. Next, sira, so it is called siraj granthi, and it is even, as you know, it is krichrasadya only, it won't cure completely. If it is primary, obviously it won't cure completely, because there is a valve incompetence is there. So like that. And if it is having saruk chalam, means it is moving and with a little mild aching pain and all, means it is kritrasadya. But if it has become aruk, means it is because of the chronicity, there is no pain, and it is achalam, it is not even moving, the veins are not moving. And in it is, if it is big and marmotidam, so all these condition it is asadhyam, so it should be avoided for treatment. Vivarchaniyah. Aruksa evacha evapya achalo mahamsha marmotidaschabi vivarchaniyah. So that is about Siraja Grandi. Actually, next types actually I missed. So in that Ashtanga Hridaya, actually the other Mamsa and Asti is nothing much important. In that Mamsa Grandi, actually Mamsaler Doshidam Mamsa Mahara Grati Avahed. So what happens? Bad kind of meat and all Mamsala Aharam is intaken, and what happens? There will be excess of kapha aggravation and having the some forms of granthi or some swelling. So that is explained mamsa granthi, and it is told as asadya also. And in case of asti granthi, mostly it is develops after a fracture or any injury which result in any upward displacement of bone. So in that also asti banga complication, like that only asti granthi is explained. But Vrana Grandi, it is actually important. I'll give in the notes. So what happens is in any Vrana, okay, in Vrana Grandi, Arude Ruda Matreva. So after healing or during the healing process of any wound, if the patient no, if the patient is not following the patyas, okay, patya patyas is not following both ahara and vihara, or sometimes get again wounded in any surgical wound or any Vrana, if it is having any pathology after the healing process or during the healing process, or if the vrena is not bandaged, so like that, the any resulting in the as a complication of a vrena, that is called vrena granthi. So in we can correlate it as a keloid hypertrophic scar and all, like which occurs after a surgical wound. Okay, so that we can correlate, as I will be sharing in that notes, Rene Grandi. So that is actually important. Then coming to, Sister that didn't explain that. It is according to Ashtanga Hridaya only. Next, coming to the treatment. So first treatment, general treatment is given. What is the general treatment? First we have to, in the mama stage, if it is not going to burst, so in that stage, what we have to do? We have to treat it like a shofa. Shofa, the Ekadash Upakrama, it is explained in during the Brahma Shashti Upakrama. In that Ekadash Upakrama is given for shofa. That shofa treatment should be given in as a general line. Then even Sarpi, Thailam or Vasat Rivrit, which is Dashamula Siddham, or according to the dosha, we have to give. That is the general chigilsa. These are the Ekadasha Upakramas. Alepam, Parishekam, Abhyangam, Svetanam, Vimlapanam, Upanaham, Pachanam, Vistravanam, Snehanam, and Vamana Virishna. Okay, this you will be learning along with the Shashti Upakrama in Brana Chikilsa. Then coming to the Vadaja Granthi Chikilsa, Himstradi Lepa is told. Then say normally for any growth is there means first we do some swedana. Then after that we'll tie that lepa, some leaves and all, and do upanaha. And then if it is undergoing paga means what happens? We should inside that or any incision is done, and we have to drain or sorry, we have to excise that which is his mass is there, we have to remove that. And after that we have to do prakshalana with kashaya, and then pranaropana shodhana ropana is done. That is according to the for the vadaja granthi. So first, and in some text it is explained like snehana karma is given. Then pralepa shastra karma. And already I told we have to remove whatever is there. If it is a cyst is there means we have to remove. Then vrana ropana shodhana ropana. Next coming to the pittajam. Pittajam, what is indicated? There is pitta or rekta dushti is there. So we have to do jaloga avajarana. Then after that shirodaka parishejana. Then intake of different kashayas, which is or draksharasa, ikshuras, sorry, draksha rasa ikshurasa. Then haritaki churnam, haritaki churnam, use of haritaki churnam is told along with this draksha rasa and ikshurasa. Then different type of pradeha is told like trina shunya kandam. Mm. Then if it is pakkum, what we have to do vidaranam or the pardanam or the incision should be done. Then puya damanam is should be done using vanaspati kashayam, using vanaspati kashayam, kashayana vanaspatinam. Then after that shodhana robanam using taila, which is yashti madhu siddham or madhura aushadha siddha sarpi. So this is about pittaja grandhi chikitsa. Then coming to the kafajam. Kafajam, every time first line is Svedana. So first we have to do Svedanam, then Vimlapanam, that is kneading around to remove any pus or anything is that kneading, Vimlapanam. Then after that Alepanam, different Alepana is given. Okay, with different types of drugs. No need to go into the deep. And it is told like if it is amarma jadam, if it is not in marma, we can do even in the apakwa stage itself, we have to do the pardanam, because as it is kapha, it may not undergo correct paga stage, or we cannot understand the paga stage. So in the abakwa stage itself, we have to do the vidaranam, and then after that dahanam. If after stops, the site should be burned, and just like a sadikshada treatment, how it should be. So sadikshada treatment according to the so that is for the kafaja granthi. Next, okay. After that also shodhana ropana we should be doing after getting incised. Okay. Next coming to the medojam. In medojam, what we have to do? Tilakalka. So after in armor stage, actually we have to smear with a lepa with a tilakalka. It is placed between some cloth to cloth, and then that is applied. After that, in the amavasya itself, we can do dahanam, or agni karma using loha only. Then after that, we can use the laksha, or that and all we can use either agni karma using loha, or like laksha, or pralipta darvi mada lakshaya or pradaptaya. So like that agni karma or mild svedana also. Then prakshali mutrena, here using mutra it is given. Okay. So after that, if it is separated means, or undergone paga means, we have to do pardanam, and after that dahanam should be done. Shodhana using mutra, or prakshalna using mutra. Then lepa of tila, suvarshika, haridala, saindava, shaudra and giridda. And more of shara. So of as we need medu hara, so we need gomutra, shara and all are used. Okay. Then coming to after that, as ropana taila can be used. Next, coming to the these are the we'll be explaining in the notes. So in the treatment part, actually, Siraj Grindri treatment actually not explained by Sushruta. It is explained by Vagbada only. So in actually four line of treatment is given. What is that? Sahajaradi Thailam, Sahajara Thailam Panam. So Sahajaram Thailam it is indicated. So we will give Sevya Paga of Sahajara Thaila, Sevya Paga in Kashayas we used to give. Then Upanahas Sveda with Vadahara Dravya and different type of Vasti karma is indicated like Manjishtari, Shara, Vasti and all we used to give. Then Sira Vedana karma. And that all you all know how the Sira Veda is done in varicose vein. Okay. Next, coming to the Brenna Grandi. I told Brenna Grandi is one of the important. In that also, Pralepa using Brihati Chitraga Kandakari Grita. Then Upanaha Sweta is indicated, and in that also Chedana, like as that keloid or like any hypertrophic scar that is incised and excised removed. Okay, that's Chedana karma is done. Then after that, Brana Chikilsa is indicated. Next, so that is all about the different types of Granthi. In the Sadhya Sadhya one has Sadhya Sadhya actually Sadhya Doshastra Medoja. So all this Dosha Astra Medoja is a Sadhya only. But if it is in Stula Khara Chala Marma Kandodarasta. So if it is very hard or fixed, or if it is in Marma Kanda Udara, in that it is not Sadhya. So like that it is explained. So that is about the Granthi. So I think that is you understood about Gandhi. Next, coming to the next topic, it is so I forgot to tell the correlation. So mostly the cyst it will come. Next slide, next PPT, I will be sharing that modern part of cyst and the benign tumors or any lymphadenitis like that we can correlate. I will share the notes in that correlations. And finally, the Siraja Grandi, it is correlated to varicose vein also. Okay, so that's all about the Grandi. Next, coming to the Arbuda. So it is a large glandular enlargement is called Arbuda. Nirikti actually Arak Himsayam or Aram Bundadi. It is resulting in death, which causes death. Himsayam, which kills the patient. So that is the term Arab Himsayam or Aram Bundadi. That Arbudam. Arbudam term means either it is a crab or a so many in like in stories that it is Arbudam means it is a mountain. Maybe all the synonyms we can use. It is enlarging. The cells are growing like a mountain, right? Then synonym of 100 crore also, 10 crore also. So that is also Arbudam. Then a demon like a serpent also is there. So it is like a dreadful disease only. So these are or which can cause a death, arabhimsa. So that is about that. Then coming to the nidanam. So what in practically what will result in cancer or any arbuda or any tumor result? It may be like Vipragishta Nidana or Sannikrishta Nidana, we can tell. So in that Vipragishta Nidana is Bija Dushti and Khavaigunyam. So all these Sannikrishta Nidana, Alpa Aharam, Rukshannam, Katu Amla Aharam, Vidahi Aharam, like or any like Viruddha. Hmm? Then Avishyandi Aharam, then madhyam, smoking, all the different addictions. Then vishama aharam, viruddha aharam, atavam, ashramam, all this in excess. Okay, so what happens? These all can be the nidana. So coming to the samprapti. So all these nidanas resulting in tridosha visheshan, and there will be jadaragni mandya, the arm of development, and then after that agni, the Atagni Mantya will happen. Then Mamsa Vahashodo Rodam. Margaroda to the Vayu, Adipravritti of Vayu, and Mamsa Adivritti, resulting in Arbudha. So, as you know, the genetic factors are having so Artava Dushti we can consider, and so many viharas which result in different types of uh, which allows lack of exercise we can consider as the viharas, like excessive body weight or any obesity. So that like that we can correct it. So only I added this in the slide so that these are the routines or regimens we should follow to avoid such things to be happen in future. Okay. So upashya also we can consider it as a like a vada, as it is vada kapha predominant. We should alternately use all the vada shamana and kapha shamana, ahara vihara and aushada. Okay. Then anupashaya, mainly dadi takra madhya shrama atapa, all these nidanas we should avoid. Then upadrava, the as a cancer develops and all, there will be immunity will be lost, or the ojakshaya we can consider as ojakshaya, or vyadhikshamata is reduced, like that. Okay, so only they will be getting anemic, or they will be fully body will be weakened. So that and all can be considered as Upadrava. So, first of all, what is the definition? Definition, it is in the references in Sushruta Samhita, Nidhanasthana 11th chapter, and Chikilsasthana, it is 18th chapter. So, Gatra Pradeshi Kojideva Doshaha Samurchida Mamsam Abhipradushya Vrittam Sirams Mandarujam Mahandam Analpamulam Chidavridya Bhakam Kurvandi Mamsopachayam tu Shofam Tam Arbudam Shastravido Vadanti. So what? Gatra Pradeshe. So in anywhere in the body, Pujideva doshaha. So these doshas are getting aggravated, localizing in any part of the body and aggravating and vitiating that local mamsa. Mamsam abhi pradushya, that develops vritta stiram mandarujam, the growth or the swelling, how it will be round. Stiram means it is fixed to the nearby structure. Then starting stage there will not be any discomfort, so only the late diagnosis is the usual complication. Okay. Then mandarujam mahandam, it will be deep rooted. Analpa moolam, deep rooted, or mahanda means big in size. Then Chiravriddhya Bhagam. So it is developing in gradual course, Chiravriddhi, and it is not getting separated, or there is no pus formation. So Kurvandi Mamsopachayam to Shofam. So that is because of this Mamsa, it is resulting in a swelling. Okay. So next types. How many types are there? Vadena, Pittena, Kafena, Chavi, Rektena, Mamsena, Cha, Medasa. Yajayade tasya. Okay. So Vada Pitta Kapha, everywhere it will be there. Then Rekta. Rektajam, Mamsajam, so Medojam. So extra than here no Siraja like Siraja Granthi, no Siraja Arbudha is there. Instead of that, we have Rekta, Mamsa, and Medas. Okay. So in that start, all the symptoms, it is told similar to the Granthi only, but the only difference is it won't undergo Paga. Okay. So that is according to the symptoms of Granthi only, it is explained, but treatment is different if it is Arbuda. So Vada Pitta Kapha and Medas is explained as a symptoms of Granthi only. So extra we have to learn only two types, that is Rektajam and Mamsajam. So what do you mean by Rektajam? Rektajam, it is Doshah Pradishto Rudiram Sirastu Sampidi Sankoja Gadistu Abhagam Sastrava Munnahidi Mamsapindam Mamsangurajitam Ashuvriddhim Sravatyajastram Rudiram Pradushtam Asadya Medat Rudiratmakam Syat Rektakshayobhadrava Pididutvat Pandur Bhavetsu Arbuda Pididastu. What do you mean by that? There is aggravation of dosha along with the rudira. That the importance is has come more. Then it is getting localized in a sira. Sirasu sampide sankoche gadas. So here also there is some squeezing and contraction in them and give rise to a apagam, which is not a growth, which is not giving or not ripening. Okay. And Mamsapindam, Mamsangure, Rajitam, Ashuvriddhim. Actually, you can consider like a, in any case of CA rectum and all, because there is more of this circulation is there, blood circulation is more there. So we can consider CA rectum like cauliflower like growth and all. We can consider it as a recta arbudam. Okay, it is not the leukemia. We can consider because here it is mentioned mamsapindam, mamsangure rajidam. Like small growths are there in that one growth. Like cauliflower like growth and all is there in CA rectum. So we can consider that mamsapindam, mamsangure rajidam, ashuvriddhim. It is once it is diagnosed, it is getting that much speed growth. Okay, because of the rectal involvement, that speed of growth is there. Shavatyajastram, rudiram, pradrushtam, asadhyamedit rudiratmakam syat. So there is fast progressing nature is there. And you know, CA rectum first one of the best example where it bleeds on touch. We can consider that Shravatya adjustum, even a small touch with a gloved hand will cause the bleeding. So like a bleeds on touch, then incurable, asadhyam, pradushtam, asadhyam edat rudiratmakam. There is complete blood loss is there, rudiratmakam. So what happens? Rekta shayopadrava piditatvat pandur bhavet. As the complication is the blood loss, there will be pandu. The patient will become anemic. Okay. So that is about a recta arbuda. Next, coming to the mamsa arbuda. So it is told as asadhya also. Then both these, recta arbuda and mamsa arbuda are asadhya. So mamsa arbuda, what happens? Mushti praharadi, mushti praharadibir ardide, ange ange mamsam pradushtam prakarodi shofam avedhanam snigdam ananya varnam apagam अश्मोपमम् अप्रचाल्यं प्रदुष्टमांसस्य नरस्य बाढमेतत् भवेत् मांसपरायणस्य मांसा मांसार्बुदं तु एतत् असाध्यमुक्तम्. So it happens when any trauma happens at a place where there is body is either hit by the fist or like any trauma happens either in case of any fights or any trauma also in other accidents like that. So what happens? The mamsa is getting initiated in that local place and give rise to a swelling, which is avedanam, snigdam, ananyavarnam, apagam, ashmopamam, hard swelling, which is painless. Okay. So like that, any growth is there that can be considered as a mamsa arbudam. And mainly, and even one more, this is there. Pradushta mamsasya narasya badamedes. So who is those who have vitiated muscle, okay, and even who partake meat constantly. So continuously, who is having meat constantly also is having that is considered as a etiology for mamsarvada. So it is also asadhya. And coming to the chikitsa. So vadacha arbudam. I told the symptoms are similar to Granthi only. So here vadacha arbuda. What are the treatments? First, it is called Upanaham. Then Swetanam using Nadi Swetam. Or then after that, Stringena Rectum Haret. Okay, Stringa, using Stringa. You know, Vadika type is treatment is using Rakta Mokshana is using Stringa. Then Pana of Niruha, Paya and all. Like, oh, sorry, Pana of Trivrita Sneham. We pay Trivrita Sneham using Shatakyam. क्षीराम्लद्रव्ययुक्तं वादग्न औषध things medicated वादग्न shara amla sorry amla and paya, all these drugs is used in trivrit. Okay, trivridam sneham, that is the for the treatment for vatikam. Then coming to the paitikam, Paitikam or Pittajam, what happens first? We have to here we need to do same Swetanam using Upanaham, Swetu Upanaha. Then Mridu Virejnam, as you know, Pitta is increased. So we have to do Mridu Virejnam. Then Vikarshana with the Udumbara, Shaga, Gojihva. So Vigarshanam. Garshanam is explained or Lepa we can do. Then some grita and grita panam, shama, the ganam is important. Okay, in pitta. Next, coming to Kafajarbudam. Kafajarbudam, Shodhanam. First of all, Urdhvada Shodhanam should be done. After that, Rektamokshanam. Rektamokshanam. Then Pradeham. Pradeham. Even Parada Parad Kapoda Paravada Vid. So Pradeha Lepana having Paravada Kapoda Vid and Kamsya Neela. So many Shara and all explained. Okay, as Lepana. As it is, growth is much bigger, so we have, and one more important topic is that maggot therapy. We can correlate it as a maggot therapy. So what we have to do is Nishpava Pinyaga. So some of the drugs like Nishpava Pinyaga, Kulata, all this Kalka and Mamsa Pragadam, excess of Mamsa is taken and the Mastu is added. All this is actually for the attracting krimi, okay, krimi, so that the flies come and eat that swelling. So like that it is explained, and once it is eaten maximum, and what happens, the flies will get attracted and they will lay eggs. So what, next day it will be burst, or eggs will be hatched into worms, and that worms or the maggots, what it will be eating away the growth. So mostly it won't be having any pain. Okay, only is and it is only small remnant is there. At that time we have to scrape, or the lekana of the full region is done and burned with the fire, and it has to be kept with a circled by a thin sheet. Okay, so maggots, when it is eaten by maggots, a small leftover is there. At that time we have to do lekana and agni karma, and the remnant after that we have to either do shara agni shastra karma after covering it with a sheet of metal, either copper, tin or lead, and we have to, because to protect the normal area. Then but according to the bala of the patient only we have to do this. After that, normal Vrana, Shodhana and Ropana, like Shodhana using Kashaya prepared with Aspoda, Jadi, Karavira. These all are actually pain relieving and good, resulting in a Shodhana of the Vrana. And once it is a clean wound, it will become, at that time, Ropana Thailas we have to apply. Okay. So if it is Pakka, like a Pakka Granthi, Upakrama, we have to do. That is about the Kafaja. So it can be asked for 5 mark question, as maggot therapy is there. It can be asked simply as Kafaja Granthi, Kafaja Arbuda Chigilsa, like that, or importance of Kafaja Arbuda, like that it can be asked. Next, coming to the Medoja Arbudam. So Medoja Arbudam treatment, Swetanam, then Vidaranam, and after that Shodhana of that region, or Vrana Shodhana. Then using Karinja Thailam Madhu Pragadam, or any like a Grihatumam, Lodram, Padanga Churnam, Manashila. Some strong materials are looked, not herbal, like mineral compounds are also used. Okay, so like that Medojam, because it has reached to till that Medas should be removed. So Shodhana with a paste of Haridra, Grihaduma, Rodra, Patanga, Manashila, etc. with honey, and Karanja Taila application after Shodhana. Then coming to the last point, that is Adyarbuda and Dvirarbuda. So what do you mean by Adyarbuda and Dvirarbuda? Yajayade Anyat Kalu Purvajadam Niyam Tad Adyarbudam Arbudatnehi. Yadvandajadam Yugabat Kramadva Virarbudam Yacha Bhave. So I think the different type of spread, how the arbuda will be, or a cancer will be spreading to the nearby or other organs. So we can consider it as a virarbudam when it is uh, coming. Yugabat Yajayade Anyat Kalu Purvajadam. So when it is forming in another place, okay, another place where it is where than and first formed place. purvajadam, that is called adyarbudam. So it can be considered as a distant metastasis. Yet Dvandajadam Yugavat Kramaga. So Dvirarbudha means the direct spread. Okay. So like that, how it is spreading to the nearby organs or nearby structures, it is called it is comes under this Adhyarbudam and Dvirarbudam. Why Arbudha won't undergo separation? What is why it is not undergoing Paga like I told now. In Dvanti there is it is when it is burst like that symptoms. But here because of the Kafadik na pagamaya kafadikyatvad and kafadigatvad medu bahutvad. Medas, the importance of medas and kapha is more in this condition. And doshas tiratvad kratanat, there is hard swelling which is and there is it is fixed in some position. Okay, so doshas tiratvad kratanat cha tesham sarvat Arbudanyeva nisargadastu. So because of that, there is no paga formation. So that is about um, okay. So that is about the Adyarbuda, Dvirarbuda, and the excessive the prevention of the separation. So that's about both this topic is over. I'll move on to next topic. That is the modern correlation here. Both So next topic that is the correlation, modern correlation of the both the Granthi and Arbuda. It is we can consider it as a tumor, both benign and malignant tumor. So what is a tumor? It is a growth of new cells which proliferate without relation to any body's need. Okay, so that is the simplest definition. That where the cells are having no function. The big definition is that any abnormal new growth of the tissue that grows by cellular proliferation more rapidly than normal continues to grow after the stimuli that initiate the growth ceases or stops also and show a partial or complete lack of structural organization. The cells are becoming dissimilar. Okay, and the functional coordination with the normal tissue and usually forms a distinct mass of tissue which may be either benign or malignant. Okay, you can see the picture where the normal cells are there and how the cancerous cells will be. Then etiology. Etiology generally we can tell us oncogens, some of the food materials or some chemicals, all or some viruses even are causing some like carcinomas. Okay, then some of the genes are play in an important role in the prevention of cancer also. So if it is not the like that also it is there. Then coming to the classification, classification of carcinoma is important. Then benign and malignant tumor. So there is difference between what is the difference between benign and malignant tumor is one of the important question. So benign tumor means there is accumulation and transformation to reproduce abnormal numbers but remains within the original tissue. It won't spread. Okay, it is usually encapsulated. Frequently they are multiple. Then malignant tumors means capable of invading adjacent structures and leaving the original tissue. That metastasis also happens here. So this is how it will be benign tumor and malignant and tumor. Next, second one is the histological classification like carcinoma, sarcoma, leukemia, and lymphoma. So carcinomas mainly arise in endodermal or ectodermal origin. Then sarcomas, mesodermal origin. Leukemia or lymphomas derived from the WBCs and monocytes, that is macrophage system. Then teratoma and blastoma is there. I think you'll be familiar with all these terms. Types of benign tumors: papilloma, fibroma, lipoma, neuroma, neurofibroma, neurolemoma, or the schwannoma, then chordoma. As UGs, I think it is not important. If anything is there needed, means you just message me in this one, Telegram. Then next types of malignant tumors. You can see how it is the carcinoma or epithelioma, melanoma, sarcoma, how it will be. Okay, so that spread melanoma, you can see how it is spreading. The squamous cell carcinomas. And one classification is like that: squamous cell carcinoma, basal cell carcinoma, melanoma. But I think for our syllabus, it is not that much important. A mostly asked question is the difference between benign and malignant, then sarcoma and carcinoma, and otherwise that stages classification like that. So, what do you mean by the differences? What are that benign and malignant? Benign, it is well differentiated. There is malignant, there is lack of differentiation. Then structures are typical of the tissue or the cell of the origin. Malignant cells, malignant tissue, there will be anaplasia. That is, the structure is atypical of the original cell. Then here, benign means smooth, slow, and progressive rate of the growth. There is rapid growth or erratic growth or dreadful growth are there. The normal mitotic figures are there in benign, and malignant mitosis is not localized, not capsulated. Here there is well localized and capsulated, then infiltrate to the surrounding tissues. Malignant, it will be infiltrating. Then do not infiltrate to the surrounding tissues. Then here no metastasis, and metastasis through actually four means are there: lymphatic, blood, and direct spread, and transcelomic. Then coming to the curable, mostly benign tumors are curable, or it can be like maintained like that also in some cases. Malignant not may not be completely curable. Maybe in the starting stage and all, if it is diagnosed and without any even a single bud escaping through either blood or lymph, at that time it can cure. Okay. Then few benign tumors after a long time may turn into malignancy. And almost every cell starts with the malignancy only. Next, coming to treatment is treatment is simple in case of benign, and malignant it is complex and complicated, involving all the chemotherapy and radiotherapy and all the surgical methods we need. It is it's complicated. Here, benign no recurrence will be there on after excision, but recurrence can occur in malignant. Next, I already told squamous cell carcinoma, basal cell carcinoma, glandular. That is not important in your case. Then etiology of carcinoma, alcohol, tobacco, then some radiations, ultraviolet radiations, that and all in excess. Then genetic causes, hereditary causes, then dietary factors, chemicals, viral factors, all these are there in the etiology. And what is sarcoma? Sarcoma is a tumor of non-epithelial modified embryonic connective tissue. Okay, may affect bone, bladder, kidney, liver, lung, parotids, and spleen. Some of the actually types are lymphangioma sarcoma, angiosarcoma, osteogenic sarcoma, fibrosarcoma, Kaposi's sarcoma. So some of the examples are there, but the difference that is important. It is, as I told first itself, I told that it arises from the mesenchymal tissue. Then carcinoma arises from epithelial cells derived from any of the three germ layers. Then sar means flesh, oma means tumor, carcinoma means crab like. Then here's a sarcoma will be having smooth, firm, and hard swelling, firm or hard swelling. Carcinoma is always a hard proliferative with a verted edge. Then sarcoma, warm and vascular with a dilated veins over the surface. Carcinoma don't have like that peculiar nature. Then spreads through blood, mostly to the lungs, liposarcoma, fibrosarcoma, etc. Both blood and lymphatic spread is there in carcinoma. So that's all about the difference between carcinoma and sarcoma. Then coming to the metastasis, that is also one of the important topic, which are the four ways or four mode of spread. That is the metastasis, mainly four. That is by infiltration to the direct spread. nearby structures, how it is invading. Then by lymphatic spread, then through blood or hematogenic spread, then along natural passage that is rare only through serous cavities, then by inoculation. So like that inoculation and natural passage is very rare, some rare cases only. But serous cavity, like an example is transcelomic spread. That is example is Brukenberg's tumor. It is explained in case of any abdominal there's a malignancy is spreading to ovary. So how we can it is in the peritoneum. Okay, from peritoneum near the fallopian tube, some small opening is there in the peritoneum. So any there's a malignant small buds will come and enter through that fallopian tube ending and reaches the ovary and causes ovarian cancer. So like that, it is a transcelomic spread between some compartments. Okay, so these are the some common metastasis areas like brain, then respiratory, lungs, lymph nodes, liver, skeletal, or in the bones. Like that, some of the symptoms it is explained. Okay. Next, pathology and spread. I told how it is spreading, like permeation, embolization, retrograde lymphatic spread, like that. It is there. No need of deeper. It is not needed. I'll try to add in the notes. Then grading. So well differentiated, moderately differentiated, poorly differentiated, and less than 25% differentiation. So like that, it is explained 75, 50 to 75, 25 to 50. Like that differentiation, how it is, uh, that grading is explained. Then molecular basis like initiation, promotion, and progression is explained. Um, then how we have to do the examination, as you all know, it is biopsy, then incisional biopsy, excisional biopsy, true cut biopsy, pap smear, FNAC, then fine needle aspiration cytology it is. Then frozen section biopsy, punch biopsy, different types of biopsy are there. Just go through that. Then histochemistry, immunohistochemistry to detect any antigen using an antibody. Then exfoliative cytology and radiological methods. Uh, then other laboratory investigation, these all should be done. And some tumor markers, like most commonly we will be checking tumor markers in case of benign tumors to rule out malignancy. One example is prostate. In prostate, benign prostate hyperplasia, BPH, which is common in after 50 years of male. So what happens, the prostate will start enlarging. So it is usually benign, but we have to check the marker. Okay, PSA, prostate specific antigen. If we are testing it at that time, we that within the normal limit, means it is normal. If BPH is having, means it will be elevated but not beyond that value. So like that we have to we can find some tumor markers. Okay, so it is called carcinoembryonic antigen and fetoprotein. Some of the important markers are there in each each carcinoma. There is specific and these markers are there. So if we if we are suspecting any benign tumors to be converted to a pre or it is as a pre-malignant, we can get the upper limit. So like that we have tumor markers. Then some other screening test and all, like that botulinum blue test, actinium binding method, like that is there in mouth ulcers and all. Then coming to the staging. So staging of cancer, what is importance, because of for the treatment planning or the standard communication, because of staging, standard communicable description of the tumors, comparison of the treatment result. So for that we need staging. So in that, one of the important classification or usually asked question is TNM classification. So T stands for tumor, then N stands for nodes or the lymph nodes, and metastasis, M for metastasis. So you can go through that. I'm not detailing it. Just go through that. It is easy to understand only. So according to the size, the tumor is measured. Then according to the nodes, whether the regional lymph nodes are there, or to the ipsilateral nodes or multiple ipsilateral nodes are there, or bilateral or contralateral nodes are there, or complete nodes are there. Like that, it is explained in the case of N. Then categories of M0, MX, M0, and M1. So in the according to the metastasis, it is explained. So according to that, stage one, stage two, stage three, stage four is explained. So that is also used during the treatment. So they will be giving which stage, and according to that, treatment protocol is made. Then modern treatment, as you know, surgery or excision of that part, or any, if it is abdominal, means there will be some that part is removed and anastomosis is done. So like the surgeries are the radiotherapy, then chemotherapy, or some laser, immunotherapy, gene therapy, and all. Radiotherapy, so mostly potentially curative in all overall cancer, but it is used in during using alone, or in some cases, and along with the surgery also it is done. But it is having some complications like side effects in head and neck, or necrosis, like that it is occurring. Then coming to the chemotherapy, cytotoxic drugs. Okay, mostly it will be used in palliative benefit to reduce the pain or shrinkage of the tumor mass, but like usually as a part of palliative regimen only. Some agents like your one, you can by heart fluorouracil if you are increased and all. If you are hurt, means you can just write in the exams also. Then some immunotherapies, then some like antibodies against monoclonal antibodies against tumor. So many techniques are under investigation. Okay, immunomodulators, then high tech surgery, like nowadays robotic surgery and all is there. Then cryosurgery, laser photonic surgery, then gene therapy, targeted gene therapy, like that all are there. Then after that, we have to, obviously they will be having severe pain, or like bedridden cases, then palliative care we may need. Then coming to the Ayurvedic treatment, how, as I told, both Arbuda and tumor I have explained. So Ayurvedic treatment, all the which are explained, Upanaha, Agni Karma, Prachanam, Siravedam, all these we can try according to the condition. And some of the even palliative care also we used to give Jatyadi Tailam, Drakshadi Kashayam, Varanadi Kashayam, all Gugulu preparations. They are all painkillers. So as a palliative we can give. And so to some extent, if it is detected in the start, they can, the quality of life can be increased. Okay, and then some of the drugs which are generally having some anti-cancer and anti-leukemic activity. Okay, then based on the tridosha theory, we have to treat. I think that and all same only. The types of arbuda and all explained. So according to the different diseases, I have prepared for PGs only. So same only, but we can just see how we can correlate, like pittasham, kaphajam, and in modern case kaphajam, like fibroids or any this is arbuda. So like that you try in something, or medojam, some masses like that. Then Arbudam, Recta Arbudam, Mamsa Arbudam, like a CA, stomach and all, we can consider as a Mamsa Arbudam. So like that. Okay. Treatment, according to the treatment already we have explained all the lepanas, then Rekta Mokshana, Agni Karma, different type maggot therapy. So after that, Dahana and all. Then Shastra Karma, some of the Indian drugs, Ballataki, Yashti, Madhu, then some Gugulu preparations, Kashoram, Triphala, Kanjanaram, Vidanga Gugulu, Shobhanjana Gugulu, Saptavimshadi Gugulu, Punarnava Gugulu, all these references you can find. Some of the Resa drugs also you can find. Then cancer and yoga for the increase of the cardiac output. Then sorry, oxygen consumption fall, like that, and we can use all the both yoga and meditation we can use. Okay, so and some of the drugs also is explained, some of the vegetables and all raw vegetables they used to give for cancer patients, and some apple grapes and all prevents cancer. So that's all about the anti-cancerous and all the tumor. Okay. Next, coming to the cyst. So I told we can correlate to Granthi as either benign tumor and some case of cyst also. So what is a cyst? It is a collection of fluid in a sac lined by epithelium or endothelium. So we can consider it as a two types classification. So many different classifications are there. In that true cyst, when it is lined by epithelium or endothelium, and false or pseudocyst which do not have any lining epithelium. So true cyst, what happens? There will be an endothelium or epithelium connect is covered, and inside there will be clear serous fluid, mucoid material, or pus or blood. And in case of false cyst, there will be fluid collection due to any exudation or regeneration. So, another classification is congenital, acquired, and parasitic. So, congenital cyst is again classified into dermoid cyst, brachial cyst, thyroglossal cyst. These are the examples. Okay, congenital cyst, lymphangioma, and cyst of embryonic remnants. The acquired cyst, it can be retention cyst, distension cyst, exudation cyst, degeneration, traumatic cyst, and cystic tumors. So, parasitic, either it can be Taenia solium or Echinococcus, resulting in a hydatid cyst or a cysticercosis. Then coming to the most important, mainly dermoid cyst and epidermoid cyst. Epidermoid cyst is otherwise called sebaceous cyst. So, dermoid cyst, what do you mean by that? It is lined by squamous epithelium and containing desquamated cells. The contents are thick and toothpaste like. So inside what it is, no? Okay, the content will be thick and toothpaste like, mixture of, there will be sweat, sebum, and desquamated epithelial cells, and sometimes it even contains hairs. So classification, again, it is classified in superficial dermoid cyst, implantation dermoid cyst, teratomatous dermoid cyst, tubulo-embryonic dermoid cyst. Mainly the treatment is under anesthesia, local anesthesia, the excision. So in that first one, congenital or a sequestration dermoid cyst. Mostly it occurs along the line of embryonic fusion due to the dermal cells being buried in the deeper line. So there will be cells will be sequestrated in the subcutaneous plane, proliferate and liquefy to form a cyst. So location mostly along the line of fusion, along the line of any joining of any line of fusion. Mostly there will be painless, slow growing swelling, though congenital, mostly in the either in the childhood or during adolescence it will start or manifest. Okay, or not in the at birth itself it may not come. Then there will be fluctuant, soft, cystic, and fluctuant transillumination, as it is not a very plain white water. The condition content is somewhat um, thicker, so there will not be transillumination. Then there will be a putty like consistency. Okay, then underlying diagnosis, mostly there will be any bone defect also. Okay, then implantation cyst. So what it is common in women, tailors, etc., who sustain repeated minor sharp injuries. Actually, I have seen one dermoid cyst, implantation dermoid cyst. It was for a fisherman. Okay, so fisherman, what happens? It was he was getting a thorn. Thorn was a prick. Okay, thorn prick was a thorn or actually the thorn of fish. So that has developed into a like a round, nice dermoid cyst in the fingers. So like that in a part of the finger only or palmar aspect only. So due to the injury, the few epidermal cells get implanted into the subcutaneous plane and developing an implantation dermosis. So it can be fingers, palm, sole of the foot. Okay, it develops in the area where there is skin is thickened and keratinized, develop in as a thickened area. Then becomes the hard. Okay, in consistency it will be hard. Then tubulo-embryonic dermoids, mass or lump developing from cells and tissues left over after formation of a thyroid gland. So it arises from an ectodermal tubes. Thyroglossal cyst is an example. Then teratomatous dermoid cyst, it is arising from totipotent cells, that is involves ectoderm, endoderm, and mesodermal layers, and mostly it contains some hair, teeth, cartilage, bone, etc. Mostly in ovary and testis, it is seen. Next, coming to the epidermolysis, is otherwise called sebaceous cyst. I think most of you will be, if you are practicing or you are going under any surgeon means you will get a sebaceous cyst. It is a usual complaint patients will come as a sebaceous cyst. The importance is the punctum. The diagnostic feature is the punctum. There will be an elevation or a small swelling, and it will be fixed to the surrounding tissues also. So what happens here? The sebaceous ducts are obstructed and resulting in the accumulation of a sebaceous material inside. So it is a retention cyst and it contains yellowish white cheesy material with a fat and epithelium. Does not occur in the palms and soles due to the absence of sebaceous gland. Okay, so mostly it occurs in the face, scalp, back, scrotum, etc. And at the punctum means a small opening where we can get the pus formation. Okay, just a black dot like a punctum we can see. That is a diagnostic feature, and complications sometimes infection and pus formation and severe pain the patient may complain. So that is about epidermolysis and about Cox peculiar tumor. Then clinical feature, it will be slow growing, painless swelling, smooth surface, round bodied, non-tender and mobile, soft and fruity like consistence. Then lining by only epidermal layer of squamous epithelium, and mostly it appears in the early adulthood or middle age. There will be spherical swelling located in dermis. Then hair loss over the surface is common. So we have to excise that giving the local anesthesia, incision and avulsion of the cyst with the ball is done. So this is called punctum, that blackish discoloration you can see at the tip. Okay, so that is a common example of a cyst. It is a sebaceous cyst. Next, coming to the acquired cyst, in that retention cyst is there, a distension cyst is there, exudation cyst is there. Just a name is enough, no need of detail. Next, one more cystic swelling we may get in the OPD, that is ganglion. 10 cystic swelling occurring due to the myxomatous degeneration of the synovial fluid or synovial sheath lining the joint or a tendon sheath. So it is, it is seen in the wrist. I think most of the students used to get this ganglion formation. So common around the joint due to abundant fibrous sheath or the fibrous tissue, and it will be containing gelatinous fluid. Mostly the site is the dorsum of the foot at the scapholunate articulation. In the foot, it can also occur in the foot, that is the dorsal or lateral aspect it can occur. Clinical feature mostly between 20 to 50 years, round to oval swelling in the dorsum of the hand, then smooth surface and round border. Swelling is cystic, flatulent, soft and non-tender. There will not negative transillumination and mobile in the transverse direction. We can move in the transverse direction. You can see how it will be the in between the scaffold and lunate. We can see the ganglion system. Differential diagnosis. Here I have to like already implantation dermatocyst or any bone exoptosis, then bursa, any white infra bursitis or lipoma, like that we can have the differential diagnosis. Treatment, symptomless can be left untreated. Then aspiration and injection of the fluorosin may reduce the size of the ganglion, but recurrent chance is more if we are doing excision. Then rupture due to trauma may result in a permanent cure. Then coming to the effect of cyst, the compression to the adjacent structures, infection, sinus formation, hemorrhage, torsion, calcification, cachexia, transformation. Then coming to complications, these all like hemorrhage, abscess formation, infection, pressure effects. And if it is in the right hand or all means they will be having difficulty in writing also. Okay, so like that, and sometimes it may cause for malignancy also. Next treatment is the excision and drainage, then antibiotic therapy. So we will move on to the next slide, next topic. Yeah. So today's next topics are gulma and vidredi. So as I told, these the four are swellings, different types of swelling. So in that gulma and vidridi, first of that gulma I'm going to discuss. So what do you mean by gulma? Some definitions are given. Gulma, the term meaning actually means a shrub. Okay, shrub, how it will be like a round structure. Like herbs, shrubs, and all, you know, right? That herbs or shrubs, shrubs, how it will be like a, that. It is termed in Sanskrit as a gulma. So, hit pasteyor andere grindihi sanchari yetiva achalaha chayapachayavan rittaha sagulma iti kirtita. So there will be a mass present in between Hrit Vasti, between the Hridaya and Vasti, or the bladder and the heart. There will be any mass. So we can correlate it as a, any mass in the abdominal region. We can consider the symptoms. Sometimes it will be referred, radiating. So like that, the symptoms we can't exactly correlate it to any modern any disease, because so many masses will be there, like liver can enlarge, spleen can enlarge, or appendicitis can be correlated. So like that, so many correlation we can give. So I am not going to the modern part. You have to identify according to the symptoms, and according to the site we have to identify. So here the definition is with or andere. So between heart and bladder. So all the abdominal organs. Anything is enlarging and forming a mass means that we can consider under gulma. So it can be either movable or stationary. Sanchari yativa achalaha. So it can be either movable or stationary. And sometimes achaya apajayavan. It is undergoing increase or decrease. And vrittaha. The shape is round in shape. So even the abdominal normal gas formation like distension and all, that and all we can correlate here also. Next, how why it is called like that? Gupita anila moolatvat drida moolodayadati gulmavat va vishalatvat gulmaha ityabhidide. So why it is called gulma? Since it is having root cause as a Gupita Anila Moola. Gupita means it is hidden. Hidden cause is Vada. Okay. Gupita Anila Moolatvad, or it arises from a Guda Moola, a deep place it is coming. That symptoms is arising from a deeper abdominal organ. So that is what Guda Moola, Moolodaya Devi. Gulma Vadva. Gulma means shrub. It is a broad like a, or that round shape like a shrub. It is called gulma. That two slogas you have to by heart. Then five sthanas or astrayas are given. That is Pancha Gulmastraya Nrina Parshe Hrinnabi Vasteyaha. So two Parsha and Hrinnabi Vaste. All these we can consider as a astraya or sthana. Then why it is not undergoing paga? So here it is just like Arbda we told, it is not undergoing paga. Here also, what is the reason? It is increasing by its own. There is no, is not depending on any mamsa or any rekta. Okay, it is increasing by its own, like a bubble in a water, and moves inside the abdominal region. Okay, so it is not considered as a it is not undergoing paga. Next, types. So five types according to everyone has explained. Actually, Sushruta explained it is in the Uttara Tantra. Okay, so five types explained: Vata, Pitta, Kapha, Tanipadika, and Raktaja. It is seen in three only. Okay, so that is the types. Next, coming to the Purva Rupa. Satanam, Vandata, Vannir Adovo, Andhra Pujanam, Vinmutra, Anila Sangasha, Sauhitya, Asahadatada, Dveshu, Anne Vayurudamcha, Purva Rupeshu Gulmina. So, what are the Purva Rupa? All the symptoms which is resulting in any like Manda Agni is there, and abdominal discomfort is there, Ardovum, Anthrakuchinam, gurgling noise is there, or tymphanitis or noise inside the abdomen, then gurgling noise, then non-elimination of the feces, urine, flatus, then due to any intestinal obstructions also it can occur. So like that, any intolerance to the comfort, aversion to the food, or any upward movement of gas like that, all can be considered as a Pura Rupa. Next, come to the Rupa. What is the Vadaja Gulma? The, as you know, all type of pain. So first the pain where it will be hrit kukshi shulam. There is in the epigastric pain, hrit kukshi shulam, mukha khanda shosham. There will be dryness of the throat and mouth. Nirodho. There is obstruction in the platters also. Vishamagni, the Agni digestion is not proper. Te vikaraha pavanatmakasha pavandi gulmo anila bhavet. Okay, so all this pain will be there in the epigastric region or hrid kukshi shulam. Hrid kukshi shulam. Hrid means mostly epigastric pain. It can correlate to epigastric pain. Then there will be the most of the patient will be complaining of mukha kanda shosham, and there will be the obstruction of a gas or the flatters. Then vishama agni, digestion is not proper. That is about Vadikam. Then Pittaja Gulma. So here, excess of Swedam, perspiration or Swedam. Jwara Ahara Vidaham. There is burning sensation on taking of food. And there will be Daham of the body also. Daha, Trishna, Angaragam. There is the skin is turning to red color. Angaragaha. Katuvaktrada. There is bitterness in the mouth. Okay. Then with this, that is the same symptoms. So next is the kaphajam. So kaphajam, as I know, what we'll tell, stymithym. Don't some salivation or some inactivity. Sometimes it be like they will be very lazy. Okay. And the madhurasida. There will be sorry, Saimithya Manne Aruji Angasada Shardi Presego Madhurasyada. So Madhurasyada will be the Shardi, Preseg, nausea, vomiting, excess salivation. Then these are the symptoms if there is Kaphajagulmam. Next, coming to the Sanipadigam. Sanipadigam, all the symptoms together, and it is called as it is told as incurable also. Then coming to the Rektajagulmam, I think in Prasuti you could have learned this sloga also, Nava Prasuda, Ahita Bhojana. So all these in women who has recently delivered or who is having any in their menstrual period in a unsuitable having unsuitable food in the menstrual period or who is have delivered a premature baby. So all these women will be having vata aggravated and vitiating the recta and resulting in a gulma. Actually, we will correlate mostly as a fibroid also. And so many other correlations are there, but fibroid usually will correlate as a recta gulma. So in that, like a burning sensation is there, then pain is there, like that we can correlate. And then they have mentioned like we have to differentiate with garba, and we have to treat like that after the expiry of initial time of 8 months, 9 months, like that. Okay, so that is explained. Then coming to the treatment. So treatment, what is what we have to give Vadachagulma, we have to give Snehana, Virechana with the Sneha Dravya, then Kashaya Vasti and Anuvasana Vasti. After that Anuvasana Vasti, it is explained Mam, Anupa Udaka, Mam Vasa Taila Grida. All these are explained for Anuvasana. And Datri Phala Swarasa, then Chitragadi Grida, Hingwadi Grida, Dadika Grida, so many Gridas are explained. And one combination like some Swarjiga, Kushta, Ash of Kedagi, Basma, Sharam. Okay, all these are explained in Padaja Kulma also to be as a Paniyak Shara. So I think you have learned Shara Pakavidi in that explained. The Shara, Paniyak Sharas are explained in Gulma Chigilsa. Okay, so here comes the Paniyak Shara use. Mainly the Shara is explained in the Gulma. So in the Vadika Gulma, it is told. Okay, then again in Pitta we have to do Snehapana with Kakolyadi Kritam, Virechana with Madhura Rasa Dravya, then Kashaya Vasti with Madhura Rasa, and even Pitta and Rektahara Grida is given. Trinamula Kwade. So Trinamula Kashaya and Jeevaniya drug as a kalka. We have to prepare Grida or Negrodha the Grana, Ulpala the Grana. All this we can use for Rekta and Pitta Gulma. Then coming to We can use a snehapana using pipalyadigiridam, tikshna virijnam, tikshna kashaya vasti. So that is kapha gulma chikitsa. That is, we have to give pipalyadigiridam, tikshna virijnam, and tikshna kashaya vasti. And the grida is araguladigrida. So in that also shara vargam. Shara vargam and mutra gana is used. So tikshna, how it is will be tikshna, that much tikshna we have to give both the mutra ganam and shara varga have to be used. Next, coming to the Sanipatika according to the three doshas, and some drugs like Kingwadi Churna Vadakam, then Shatpalagritam, then Tilvakagritam, like that it is explained in Sanipatika Chikitsa. Then Rectagulmam treatment, already that also Palash, Sharam and all. I think that comes under Presudi, so no need for us. Then Shara Leha is explained. That you are just to go through that Shara Leha, that indication. No, it is consumed in suitable dose with the curd, sura, then ghee, then danyamla, like that, or warm water or soup of kulatta. Okay, so in that all the gulma can be treated. Then some soup of meat for the Vadaharam, Vadagna Aushadha Siddham is indicated. Then Vimlapana, Apyanka, Abhingam, Dahanam, Upanaham, Shidoshna Salvanadi Upanaham, Salvanadi Upanaham is explained. Then all the drugs like Udarokta drug, Sarpi, and Mutravarti Kriya, that is explained. And some Patra Lavana, then Kalyanaka Lavana, all that Lavana preparations. Then rectal suppository, use of rectal suppository, that is one of the important, where it is explained where there is obstruction of the both the flatus and vada varchu nirodhi. If even the flatus is there obstructed, or there is any obstruction in the flatus and feces also, in that condition use of rectal suppository is explained by Acharya. Then some different aristas can be prepared according to the disease, like that. And there is contraindication of kashaya vasti or niruha is also explained. Then Pipelli Mula, Chavi, Chitraga, and Saindava to be mixed with the Sura, that is also good for regular use. Now, like that, it is given. Okay. Then one of the important question asked is Gulmo Patrava. So Gulmo Patrava, you can just no need of by hearting this logo, but it is asked for 5 marks. So Gulmo Patrava, you can just understand as a shulam, different type of pain. Okay. Then there will be obstruction, Vinmutra Samrodham, Krishrochwasam, Stira Angada. There will be some rigidity of the body. Then Trishna Daha Brahma Annasya Vidagda Parivriddeha. So there will be pain increase during the digestion of the food, then horripilation and aroma harsham, aruji, shardi, all these symptoms we can, inactivity of the body parts, all these we can consider as a gulma upadravam. So for that we have to give treatment. Some of the drugs also explained like patya, three lavana, ksharam, hingu, tumburu, like that, some drugs which are tikshna also. Then so that is all about Gulma Upadrava. And coming to the Patya, Apatya, Vallura, Molaka, Malsyan, Shushka Shagan, vegetables, then aloo, gum, all this you have to just 2, 3, you no need to by heart and all. It is not asked. Just you have to understand the Apatya. Okay. So that is about the Gulma. And I think treatment almost I have tried to cover. Okay, so that is about Gulmam. Next, coming to Vidradi. So, what do you mean by Vidradi? Vidradi is any abscess. We can correlate it to modern as an abscess. So, what the Nirukti? It is definition is from, actually the Nirukti we can tell Vidhadi Vidradi. So, which is causing any burning sensation it is can be with the daha, that vidahadidi vidradi. And reference, this reference is from Charaka, the definition kiyanda shirasiyam Charaka sutram 17th chapter. Dushta rektadi matratvat savai shikram vidahyade tadaha shikra vidahitvat vidyati ityabhidiyade. So that is the definition where it is explained the importance of rekta, because of the importance of the involvement of rekta, the it will undergo paga, that the spreading nature and the separation nature is small. So only it is called vidradi. And nidana, actually from ashtanga hridaya bhukti parishita atishta ruksha shushka vidahi Stigma Shaya Vijeshtabis Taistasha Astri Pradushna. All the causes which resulting Rekta Pradushna can be considered as Nidana. Then coming to the Samprapti. So Samprapti, according to Acharya Sushruta, he has explained like Nidana resulting in Tvak Rekta Mamsa Meda, all the visitation of these doshas, visheets, and dushyas, that is Adus, Tvak Rekta, Mamsa, and Medas, and even it is getting into the Asti. Okay, so that Asti important, that part is very important. Asti, Majja, Paribhagam, or osteomyelitis. I think among the disease of bone already you got the notes about osteomyelitis, that also comes under this chapter. Then according to Vakvada, he has explained extra snayu and astric kandara also getting vitiated. Then coming to the types, in that types actually, according to Sushruta, six types. Shadvidam, that is Vadapitta Kapha, Sanipatika, Shonidaja, and Shadaja. Ashtanga also explain the same. According to the Sthana, we can classify it as Bahya and Abhyantara. So Bahya and Abhyantara, two types also it is there. So Bahya classification, in that it is explained according to the doshas. First is Vatika. Vatika, as you know, the same. We can consider as a first as a color and the nature and a paint. So like that you can make column and learn like a color. What it is? Krishna Arunam. Vatikam, it is Krishna Arunam. Then nature, it is Parusham. Then paint, Atirtha Vedanam. Okay, Atirtha Vedanam and Chitrotana Prabhagam. There will be some difference in the nature of onset and ripening. So that is about Vatikam, the nature. Then different types of pain also